think that physios can start to take action on health inequalities by asking themselves who benefits the most from their services. So what groups of people are attending their services, who's actually participating in their services, and then thinking about, in terms of whatever area you work in, who is actually benefiting from those services. Starting to think a little bit about how the research in your area is maybe constructed, what participants go into that research, and starting to be a little bit more flexible, I suppose, with how we think about services sometimes, but taking an equity lens so that we are always asking that question of ourselves in practice.
Yeah, and I would echo that. I think one of my colleagues, Professor Andrea Williamson, has done a fantastic piece of work looking at who's missing from healthcare, and actually missing this or kind of repeated DNA appointments is a marker for premature death. So it's a risk factor, and we should increasingly think about how our services are accessed and how we can make them easier to access.